This is bilious emesis. So you can see this greeny stuff that was like the baby had obviously vomited it up, and this was on all the secretions. So get used to seeing this kind of greeny, yellowy, fluorescent color. You know, a lot of the times, you know, people call it bilious, but it's not. It's just the formula or whatever. But you see this weird fluorescent color, that is always scary, always scary.
Good. We have about 3 minutes in total. So
okay, I can do this. I can do this. This is bloody stool. We didn't really go over this, but bilious emesis and bloody stool is neck until proven otherwise. So just also, I can't tell you how obsessed I am with looking at stool. I'm constantly going through trash cans, looking through diapers and looking at what the stool looks like. So this is very bloody. Get used to that. And then this is a baby with really bad abdominal distension. So you can just see how hard the belly is. You know, just it's big, it's full. You can see all the veins really fully. It looks super uncomfortable. This was actually a case of a volvulus. But, you know, a distension can look like that if you do have like an ileal atresia, or you do have neck, or lots of other things. But just kind of get used to the abdominal exam is probably the most important exam that we're doing on a day-to-day basis, because it can change so quickly. And then these are the different types of the tracheoesophageal fistulas. So like we said, this is the esophageal atresia with a distal fistula. So exactly like Dr. Sridhar said, the esophagus just cuts off randomly there, but we did have air in the stomach because it was going down the trachea, down the distal part of the esophagus, and into the stomach. That's easily the most common. So that's going to be the baby with the OG probe that gets stuck at the top, and then you've got air in the stomach. I have to go faster. This is neck. We're not going to talk about more than that. You know, it's just a very bad inflammation of the intestines. And then this is the pneumatosis intestinalis in the neck. You can see the railroad tracks and all the bubbly appearance. Then the classic sign that you see in duodenal atresia, so the double bubble sign. So this first bubble is the stomach. This second bubble is the distal part of the duodenum, or the proximal part of the duodenum. And then you don't have gas anywhere else. So this looks like it was a complete obstruction rather than a volvulus, because maybe you just have, you know, that's where the intestine was actually rotating on itself. But in this part, it's a bit more reassuring. And then this is the Hirschsprungs that we described. So this is Hirschsprungs where you have down here, you don't have any ganglion cells. So down here, you don't have the nervous system of the middle part of the intestine. And here is where all the food gets stuck, because it can kind of squeeze down to here. So if you put a Q-tip up past this, then all that poop will come flying out. I did it, Dr. Sridhar.
Perfect. I mean, you can stop sharing, so we'll have time to say bye-bye.
Okay. Oh no, how do I stop sharing? There we go.
That's okay. Perfect. So I think this was amazing today, and I'm sure everyone would enjoy the last 3 minutes show as well. I think we look forward to more practical, clinical oriented sessions as well.